Strokes. What is it? A stroke is a disruption of blood flow to brain tissue. This disruption leads to a decrease in the brain's capacity to deliver and interpret messages to and from the rest of the body. This can be intermittent, or it can be something that leads to a permanent disability if not restored, and is also known. How does this occur? There are two types of strokes: hemorrhagic, which is caused by bleeding, and ischemic, which is caused because of a partial or complete occlusion of a blood vessel. TIAs are a temporary episode of a symptomatic stroke that resolves shortly after the onset. Hemorrhagic strokes are less common and are related to compromised blood vessels. Aneurysms, hypertension, and traumatic brain injuries are huge factors. Ischemic strokes, which are more common, are caused because of obstructions to blood vessels and are caused because of thrombosis, emboli, or atherosclerosis. Again, TIAs fall into this category because they do resolve with no residual infarct. These are two types of stroke, the ischemic on the left and the hemorrhagic on the right. Strokes are the top 5 causes of death according to the CDC, and these events are more likely to occur in people over 60 years old as well as in African Americans. Family history also is a big contributing factor in people who experience strokes. People with strokes in the past are more likely to experience a repeated stroke, and mostly strokes again are ischemic and less commonly hemorrhagic. So what can lead to a stroke? Sedentary lifestyle increases the risk for thrombus formation and embolus. Poorly controlled secondary medical conditions such as diabetes, which increases fat deposits, which lead to thrombus formation. Hypertension, which degrades the integrity of blood vessels over time and causes narrowing of blood vessels. Smoking also increases the chance of stroke because it constricts blood vessels, which cause high blood pressure, and it also can cause arrhythmias, which can lead to clot dislodgement. Poor diet also increases the chances of plaque buildup and therefore strokes. How do they occur? So, tissue hypoxia begins with the onset of blood flow cessation to brain tissue, and the cause is again hemorrhagic or ischemic. As this disruption in blood flow occur, the cells are deprived of oxygen, and so as a result of this insult, they release lactic acid. Lactic acid is produced in an anaerobic state, which means with no oxygen, and excess release of this lactic acid can disrupt the acid-base balance. Next, as oxygen cessation occurs, you get decreased glucose uptake and decreased ATP production by the mitochondria. As this occurs, sodium and potassium pumps stop working because they are no longer receiving the energy. Once this occurs, you start to see the shift of ion gradients. What happens is the pumps stop working and you get an influx of sodium within the cell and an efflux of potassium outside of the cell. Cellular swelling ensues with the shift of these ion gradients because as sodium builds within the cell, H2O follows. As sodium builds within the cell and reaches a threshold of depolarization, calcium-gated ion channels open, which allow for an influx of calcium within the cell. Increased calcium stimulates the release of neurotransmitters, one of which is referred to as glutamate. Glutamate is an excitatory neurotransmitter which is released into the synapse gaps to stimulate nearby cells. Now, excess release of these neurotransmitters contributes to cell membrane damage and degradation. Excess release of the glutamate contributes to further excitatory activity in nearby cells. Glutamate, which is also received by an NMDA receptor on the receiving cell, promotes further widespread cellular damage. So as calcium increases, glutamate is released, and as the increased calcium inside of the cell, increase glutamate outside of the cell, and you have the chance of these NMDA receptors to be triggered. Once they are triggered, they do and they can promote further widespread cellular damage. Now, as this occurs, the excess release of these neurotransmitters, these receptor cells, their membranes start to break down, and as this breakdown and damage occurs, inflammatory cytokines are elicited to the area. Now, with the initiation of all of these debris particles within the cell damaging the membrane, the increased membrane permeability allows for these cytokines to flood to the area. The blood-brain barrier, which was destroyed with the initial cellular injury, is essentially a network of specialized cells that usually encapsulate the blood vessels within the brain to protect them from harmful toxins flowing within the blood. Now, this blood-brain barrier, which was destroyed, is the reason for the influx of cytokines. Now, as the macrophagy cells try to repair the damage, they also cause further damage by promoting ischemia. Increased release of these chemical mediators promote further ischemia and cellular death. As the pressure increases at the injured area by the flooding of these cytokines, we see an oxidative state form, and it's produced mainly by the substrates and inflammatory cytokines, which are harmful to the cells that are already dying. Now, this state leaves the cells at a second type, leaves these cells at risk for a second type of damage referred to as reperfusion injury. So with the potential return of oxygen, these substrates and cytokines can produce free radicals. Free radicals can induce more damage. Now, this picture kind of depicts everything I just mentioned. Mild to moderate ischemia begins with insufficient oxygen, decreased glucose uptake, and inadequate energy supplies, and failure of the pumps to work. Severe ischemia tends to take place more so after those stages, and you start to see it with the influx of water and sodium, which contributes to the cytotoxic edema, and then the influx of calcium, which leads to the excitatory state and release of neurotransmitters, which excite nearby cells, causes, this cellular energy. And then you get to the advanced ischemia, which is loss of function, accumulation of the glutamate, NDMA, and the further influx of sodium and calcium. Signs and symptoms of a stroke. You have the right side and the left side. This picture kind of just tells you the right brain, the right side of the body, what you're likely to see, and with the left side of the body, what you're likely to see. The diagnostics for a stroke. Again, head CT is done right when that stroke code is called, and that's usually done first to rule out a bleed, because ischemic strokes tend to take a couple of hours, a few hours to show up on a scan. The treatment for strokes, the goal is to essentially, with hemorrhagic, is to prevent further ischemia, stop the bleeding. And for ischemic strokes, you want to remove the obstruction, initiate thrombolytic therapy, and preserve the penumbra. Remember, with strokes, you want to be fast. These are the things to look for. Thank you. Thank you.